Okay, well, I've just finished saying that we'd get started shortly, but it's now 7 o'clock, so we might as well get started, I think. So, welcome to everyone that's watching here. Just a heads up, we are pushing this through Zoom onto Facebook Live. So, what you guys will be seeing will be about 20 to 30 seconds behind what we're actually saying. So, apologies if we don't get to questions straight away as we go, but we will do the best we can. So we're going to be doing what's called the Ace the Interview series. So I suppose I can probably change to the next slide and actually say we're not starting soon, but we're actually starting. So it's just generally covering specifically the interview process at Flinders University in Adelaide, given that that's the only university that does postgraduate entry as far as we're aware. So Adelaide University only does undergraduate entry, so not really applicable if you've sat the GAMSAT. Past that, so we're going to be talking a bit about the interview itself. We're going to give you guys some general tips and tricks as we go. And I think the best way that probably this will work is if you guys have questions specifically for us. So you'll see a bit later, I am a med student at Flinders, so I've gone through the process. So if you guys have questions, obviously we are held by a certain degree of non-disclosure. So we can't talk about our own experiences and exactly what we went through throughout the interview. Because that might get a bit messy for us. But generally, as far as how we prepared for it, our mindsets approaching questions, what we did in the weeks leading up to it, how we found the building, all that kind of stuff is stuff that we're more than happy to kind of go through with you guys. So on Facebook, or if you are joining on Zoom, I don't know that anyone's actually on Zoom with us, but if anyone is joining on Zoom as well, put questions in the comments as we go. Like I said, you're about 20 to 30 seconds behind, so we might not see them straight away. Don't stress about it. We'll get to it eventually. I think Elliot's going to chime in whenever he sees a question pop up, and I will try and answer, or if Elliot can, we'll answer as well. So getting started, we'll just briefly outline the session. So we're going to talk generally about the medical school interviews. So schools kind of do different things depending on what they see fit and what they've just kind of done throughout the past. So you see multiple different options. So MMI, which I think is probably the most common. So that's your multi-stage interview. A lot of places have anywhere from kind of 8 to 12 stations, and you move throughout. Each station is a completely separate scenario. So you might be faced with an ethical scenario one station, and the next station might be, who do you see as the best leader in your life? And another station might be, what do you think about politics? Those are quite broad, and I'm not trying to give you actual questions, but they'll be very different each station. And with those stations, you typically have a minute or two to prepare for the station in your transition time, and then 2 to 5 minutes to actually be at that station and speak through your answer with the individual that's in that room. And they're separate rooms, so it's kind of like speed dating, but you are completely closed off from the other interviewers and the other students. So the other thing is that some places, and specifically Flinders, still does a panel interview. So we'll talk about that a little bit more later, but that is more of your classic interview style. So it's one-on-one or 1-on-3 to 5 to however many they have. And you're being asked questions by multiple different people. They may take it in turns. They may just ask you as they go. But it's classic interview. You're the only person in the room as far as a student goes, and you have multiple people that are asking you question after question and just trying to see, I guess, what kind of a fit you'll be for the school. And the last general setup that there usually is a group interview. So we'll talk a few bits and pieces after, but that kind of has stems where they're trying to figure out how good of a communicator you are and how good of a team player you are, and as well how good of a leader you are. So they're trying to suss out different things through these different interviews, and they all have their positives and negatives, but we will talk a bit more about that as we go. So if all of this is completely new to you, and that was a huge quick brief overview, don't worry, we'll talk about it more. We'll go on and talk a little bit about ideal candidates. So kind of what the schools are looking for generally. Obviously, neither of us are on the board of selection for any of the schools, so we can't tell you exactly what they're looking for, but we can tell you roughly what they kind of release as their goals or their core qualities that they want out of an applicant. Question types, so we'll talk a bit about question types, what you might see. Again, we've got non-disclosure agreements with the schools, so we can't tell you exactly what the question we had was or exactly what the question will be, but we can give you an idea of the types of questions that they commonly ask. And again, the question formats too. So they won't all be straight, what do you want to specialize in if you get through med school? You know, they might be worded in weird ways. They might have different formats that they expect different things of you as you answer them. And then we'll kind of talk a bit about preparation. So how are you going to look to prepare? So obviously you guys that have found out that you have interviews, first of all, congratulations. That's an amazing accomplishment. You obviously have now a few weeks or a few months to kind of get your head around the fact that you've been given this opportunity to interview, and how are you going to get yourself in the best position possible to succeed in the interview and hopefully be selected to go to the school. I'm sure for those of you that sat the GAMSAT multiple times, the last thing you want to do is have to interview multiple times as well. So you want to get in once and do as best as you can, and hopefully feel good about what you've kind of put out for yourself. And then we'll go through a bit of a summary as well, and give you guys a bit of a debriefing for what you can see next. So I've done a lot of talking, and I know that it's probably not really logical because you have no reason to believe me. So hopefully this will give you guys a bit of an idea of why you should be somewhat listening to what I'm saying and what Elliot's saying. So I'm the bottom arrow there. So my name's Nick. I'm a physics and biology tutor for GradReady, and I have been since 2018. I am a first-year medicine student at Flinders University. So I sat the GAMSAT in March of 2018. And then interviewed last year. So was waiting on some permanent residency bits and pieces to come through, and was fortunate enough that all went through, and I'm very happily at Flinders. Guess a bit of background as well. So I'm originally from the United States. So I have a Bachelor of Arts in Spanish, which is a bit of a weird way for people to go about this. But hopefully kind of later on, I can explain it a bit more. I think some of that life experience might have helped in my interview to kind of give me a little bit more fleshed out details that some people who would maybe come straight from school didn't have. So for those of you kind of later age students that are coming in and thinking about trying to give it another crack after you've been in another job for a while, that was me. I did 5 years out of school, and then I decided to come back, which I'm still not entirely sure about. It's not easy, but it is very doable. So again, I've been talking a lot, so I'm going to go ahead and let Elliot introduce himself now.
Thank you very much, Nick, and good evening, everyone. Just briefly about myself, I'm the Interview Ready lead, one of the interview preparation courses that we run here at GradReady, and have been leading the program in Brisbane and in Melbourne since about 2015. I'm a medical doctor who's currently not practicing because I'm completing a PhD, and I'm also a lawyer as well in Victoria. And I did medical school at Griffith University on the Gold Coast, and you might be wondering why I'm here, but it's also because I had a panel interview at Griffith University, so I can give a little bit of insight, for the panel type interview as well, which hopefully will be helpful for everyone tonight. So maybe I'll take us through this slide before passing the mic back to Nick. Like as we've kind of mentioned already before, the interview is now used to select the right students for the medical program. So you've all gone through the massive turmoil that is the GAMSAT interview, the GAMSAT test rather, and you're now getting to the next stage of the marathon of getting into a medical school. It's a very stressful process, and for me, I think it was probably the worst year out of all of my medical training and practice and everything ever. There's a lot of stress and anxiety, so I want to echo Nick's comments before that you should be very proud of getting to this stage. I think it's really wonderful and a really huge achievement. For most medical schools, they weigh the medical school interview quite a reasonable amount of the final score to select whether or not you'll go into medical school, typically between 30 to 50%. So other things that would be considered there, like the GAMSAT score, of course, possibly GPA, whether it's a hurdle or actually comprises some of the percentage overall score. Depends on each medical school. And as Nick has already taken us through, there's 3 different types of interviews which we'll go through this evening, and I think probably with a special emphasis maybe on the panel interview because it's maybe the most relevant for everyone here.
Perfect. All right. So looking specifically at the multi-minute interview, and obviously this doesn't necessarily apply to Flinders, but I think it's good to have an idea of the difference as well and what you can expect out of all the interviews. And for some of you as well, you maybe looking at this interview for Flinders, but also interviewing other places. So I don't know how many people are aware, but Flinders is a completely separate application process to the GEM SAS process. So for those of you that are at Flinders or are going to be interviewing at Flinders, there's an opportunity for people to be also interviewing elsewhere. And you might see this come up. So just a broad overview, I guess we won't stay probably too long on it because it's not as relevant for Flinders. But for the MMIs, you're looking at a rotation through 5 to 10 stations. Obviously, the school themselves will decide on that. So don't hang your hat on, oh, it's going to be 5 or, oh, it's going to be 8. They'll probably let you know exactly how many to expect and how much time you'll get. So looking at that, you typically, like I said, we'll get a short scenario at each station and roughly 5 minutes per station. So that time may be spent doing different things. You may have a bit of a breather at the start of it. So a lot of times as soon as your station finishes, so as soon as the 5 minutes is done, your next station is kind of officially started. You have that time to go to the next station. Sometimes they'll have you read a cue card, or you may be given information once you walk into the room. And based on that, you're kind of told what your station will be. So it might be a question, like I was saying before, kind of like, what's your favorite animal? Or it might be something a bit more complicated. And again, we'll go through some of these types of questions a bit more later, but typically you have a couple minutes to prepare yourself. And then the rest of that time is given to speak to the interviewer in that room or in that station, and then just try and put your best self out there. The score is based on appropriateness of response to stimuli. And obviously with that, given the fact that you have 5 to 10 different interviewers and 5 to 10 different stations, there are advantages and disadvantages to that process as well. So some of the advantages are, if you perform poorly in one station, it obviously doesn't affect your score in any of the other stations, because as far as we're aware, the interviewers are not meant to be conversating with each other. So if you do really terribly in one station, or you say something really stupid, that interviewer will not be saying to the next interviewer, don't listen to what this person says. Like, they don't know what they're talking about. All right. You've got a fresh slate for every single station. So if you do say something and put your foot in your mouth, take a deep breath, take an extra second before the next station, and move on. So that's a positive of it. Another advantage is you have a different marker each station. So you have a different person, like I said, you have someone different looking at you. You have someone of a different experience. You may click really well with one person, whereas you don't click as well with another. So that might give you, again, kind of an advantage, but also potentially a disadvantage in that regard as well. So last but not least, it can be fun. Obviously, you guys probably aren't going to be looking at it at the time as it being fun. But I will say that when I did interview at Deakin, and they do the MMI setup, and it was one of the more interesting experiences I had as far as the interviews went. For me, the Flinders interview was very, very kind of straightforward, as far as I've done a few job interviews before and I've had that common panel interview. This just kind of threw that whole idea on its head. And again, I think I had one interviewer that I don't know that I gelled with very well. And I feel like I kind of put my foot in my mouth at one stage. But the good thing is I had that next station afterwards to just take a breath and go, you know what? It's going to be okay. That's 1 out of 10. It'll be completely fine. And I think I made the next person laugh within the first like 10 seconds. I was like, okay, cool. We're on here. Like, we're okay. So, yeah, you probably won't see it as fun, but they can be fun. So what's probably more relevant is the next one. So we'll let Elliot go through the panel interview.
Yeah, great. Thank you, Nick. And obviously, please chime in here, because you've done this a bit more recently than I have. But just as Nick said, this is very similar to a classic job interview, where you're sat down by a couple of different people who will ask you a series of different questions and scenarios as well. And we'll be going through different types of questions and scenarios that may appear in the panel interview. Just the ones that we'll present tonight could appear in the MMI or the panel interview, really. And as Nick alluded to, the kind of disadvantage of this particular format is that if you alienate the examiners early on, it might be something that you have to work quite a bit to regain their trust, or regain their get them back, basically, after putting your foot in your mouth potentially at the start. this is still, I think the panel interview for me can still be quite a good interview, and it gives you a lot of time to present in-depth answers. Usually they, like mine, went for about 45 minutes or so. I think they can run up to an hour quite commonly. And so you can go into more in-depth answers than an MMI, where it's very short and sharp and sweet. For my panel, and I don't know if you found this at all, Nick, I had 3 people, and I had definitely different people who were playing different roles. Like I had one person who was really engaged, really nice and encouraging, one person who was really aggressive in their questions and would cut me off all the time, and another person who was just looking out the window the entire time and just wasn't interested. So that was really interesting as well.
Yeah, I think playing on that. So this does come with a bit of a caveat in the fact that there's a bit of, and I think anyone who's looked through Paging Doctor enough has probably already gathered this, that there's a bit of I don't know, back and forth between whether or not interviewers actually do this type of thing. So there's not been confirmed that yes, we do have our interviewers play bad cop, and yes, we do have a good cop. So focus on the good cop and ignore the bad cop. So when you're in there, in the back of your mind, you're thinking, this person looks really disinterested, but you also kind of are thinking at the end of the day, well, this person may actually just be disinterested, which is kind of disheartening. But I think the idea is that taking in mind that in this type of interview, they do have that advantage of being able to kind of play different roles. And you'll see as well, a lot of times, and we'll talk a little bit later, a lot of times they get people from different backgrounds. It's not just someone from the medical school or the medical field that's in there. And so you may lose some people with some of your answers because it's not relevant. And so you kind of have to play that up with, is this person good cop, bad cop? Is it not? But I think the best case scenario with that is if you think they're playing bad cop, just assume they're playing bad cop, because it's going to make you feel a lot better about your answers at the end of the day.
I think that was my mental protection that I convinced myself of, rather than I was just, doing terribly.
Yeah. Did you have anything else to add about that, Elliot?
No, that's great. I think, Nick. Thank you.
I think with the panel, and like I said, I'll talk a bit more. So I've kind of set up a few slides at the end specifically for Flinders, just kind of general information about what they typically do and how I'd approach it. But I think the main thing is that this is a really, really great opportunity to spend time with your interviewers and get them to know you. The biggest disadvantage that I see with the MMI is that you have 5 minutes to impress one person. And I don't know, maybe some people out there are really, really talented with that, and that's, their bag of tricks. But for me, especially when you have something that you're trying to get across, if they're asking you about programs like health programs and, what you would do to try and make them better and improve them, it's one thing to try and get your answer across in 5 minutes, but it's a whole nother thing to try and get your personality across as well. So I think it gets really hard when you don't have enough time to kind of build rapport. And, it's just like anything. They say, the first 5 or 10 minutes of your conversation, you're building rapport, you're finding commonality, and you're kind of establishing how the interviewer is going to see you. And then after that, you're kind of, getting proper answers and you're working through it. But the really big positive, I think, of the panel is that it gives you that time to establish rapport with the team. Hopefully they're not all just playing bad cop, or they're not all just ignoring you. But it gives you a lot of time to kind of build that scene and kind of talk a lot about yourself and get a lot of really good things across. Whereas in the MMI, you may only be saying one thing about yourself at each station that's really important. So they're getting a very kind of narrow view of who you are as a person. Again, good and bad thing, like this, it says in the slide, it requires more in-depth answers, and you can't just move on if you put your foot in your mouth. So if you say something that offends someone, you are stuck with those same people for the rest of the time. So good and bad, but we will come back to a bit more of the information on the panel. Like I said, I've got some details later about how I would kind of approach it, and generally a bit more about the setup at Flinders. So I think we'll breeze through this pretty quick because it's not as relevant to many schools, but group interviews. So a lot of times it's a small group of students interviewed together. Most commonly, it's problem solving a group task. Again, it's kind of seeing how you work in a group, what your communication skills are like, how you are as a leader, if you can find a role that suits you and kind of take that role on, what role actually suits you, that kind of stuff. And obviously the scores are based on your ability to work as a team, professionalism, problem solving, lateral thinking. So I think sometimes with these, they don't always try to find a solution. They're not trying to see what you come up with in the end. They're trying to see how you get there and if you've actually kind of contributed to it, or if you just sat back and said, you know what, I'm just going to watch. I'm going to kind of chime in here and there, but I'm not going to do too much. And I think that kind of shows in the disadvantages we have there. So you can very easily be overshadowed by the candidates. So if you have, and I'm sure you guys have seen it through your GAMSAT prep, but a lot of the people who are applying for med are very strong personalities. And when you get a lot of strong personalities in one room and they're all trying to impress someone, it is not easy to get a word in. And, you know, may play to your advantage in the fact that if you do step back and you're kind of on the borderline leader and kind of doing things rather than just trying to shout your opinion, you can get yourself heard. But unfortunately, yeah, there's a lot of strong personalities in med that are applying for med at least. And there's a lot of personalities, strong personalities that are in med as well. So that will not change. And obviously how you interact with other people is super, super important. So if you find someone in your group that you don't get along with, it's not ideal. But again, I don't think we need to spend too much time on that because it's not super relevant to what Flinders does.
So this slide is maybe just something useful for you all to take a screenshot or a photo of. This is just a compilation of some of the details that we've compiled through research in the last few years based on the number of stations we've heard at each university, as well as time per station, time between stations too, and also when we've heard certain question types being asked at certain universities. But I just want to emphasize here, like if we look at Monash, for example, which just has a tick with the ethical scenarios, this doesn't mean that they only ask ethical scenarios, then don't ask any other type of question. It's just because we haven't been able to fully confirm the presence of other questions. Obviously, it's a bit difficult with non-disclosure agreements and so forth. But this is kind of the most up-to-date information that we could find, which gives a bit of an overview of the format and structure of the interviews. So I don't think we need to maybe spend too much time on this one, but interesting graph for those of you who want to take a quick photo of it.
Yeah, and I think one big thing to keep in mind throughout this whole thing as well is that with everything that's happening with COVID, and I'm sure you guys are probably tired of hearing that via email and online format, but with everything happening via COVID, there's just no way of knowing what this is going to look like this year. Obviously, especially for the Melbourne universities, there's no real way of knowing, and it could be a complete change for all the other universities as well. So I think keep in mind that there's no strict rule saying that any of this is going to be 100% true or even partially true at all. So keep on your toes and try and be ready for everything, I guess is probably what I'd say with this diagram specifically. I think looking, I guess, a bit at the ideal medical candidate. So it's a bit tricky because what they're trying to do, like we said before, is they're trying to find a reason to let you in. They're not necessarily trying to cut you out as a student and say, oh, they're not quite cut out for this. So they're trying to figure out what qualities you have that might help you to be a good doctor at the end of the day, because that's what they're trying to breed. They're trying to breed good doctors. So I guess kind of broad strokes. And if you guys look as well, I think the first thing I would tell you guys, if you are applying or interviewing at Flinders, is to read their application guide, because it has all the qualities that they're looking for specifically. And I've included those later on in the slides, but it gives you just a general idea of how the application process works for Flinders, what their subquotas are, what they're looking for in their candidates. And it's really important to get your head around that, because that's the university telling you, this is what we want. So if the university is saying that, you should be somehow trying to expose that in yourself. But I think broadly, and I think this kind of applies to most universities, not just Flinders, they're looking for team players. So this kind of looks into the idea of those team activities. They want to make sure that you can work in a team, that you can be a leader, that you can get along well with others, that you can kind of work with people to get to a solution. And, I think you can get this across in a panel interview as well. So I think the main thing to think about with all these qualities and these experiences that you have is that everything you're telling them should be kind of pointing towards a story or an experience or something kind of about your life that you can tell them by answering their question. You don't want to just, if they just say, why do you want to study medicine? You don't want to say, oh, I think it'd be really cool. You kind of want to back that up with something that's got some substance in it? You know, is there an experience? Did you volunteer one time? And with that volunteering, you went to Africa and you worked in a small hospital there where you saw the fact that there's not a lot of resources and there's not fair resources at all times. And you really wanted to be involved in that in a more significant way. So then you came back here and you got an internship with XYZ, and that led to you completing your med science degree and all that kind of flow on. So what you're doing there is you're saying, you know, I have these skills and I'm using these skills to answer this question, not just I'm answering this question. So things with the team players, talk about experiences you have when you've been a leader, or talk about experiences when you've worked on teams. Don't just say, oh, I'm a really good leader. I know how to lead. I'm just so fantastic at leading, because that tells them nothing. And they're going to kind of, like I said, they're looking for reasons to let you and not to kick you out. So give them those reasons. Again, they're looking for communicators. Like I said before, those team building skills. Try to use an instance where you have had to work with communication. So like this was really easy for me because I went and studied abroad in South America for 6 months, and that's really hard to communicate. So for me, I could say, you know, without sounding like an idiot and being like, oh, I went abroad in my undergraduate degree. I could give an experience that was relevant. I could give details, but it also fleshed out a bit more about myself that was maybe interesting that some people wouldn't have done. Culturally sensitive. So you see that a lot of schools now have entry programs for rural applicants, for Aboriginal and Torres Strait Islander peoples, for a lot of things like that. And so, you know, you can kind of tell that they're looking at being a bit more culturally sensitive. And so to show that in yourself as well is obviously an important thing, because they're looking for people that display that. Effective and competent, I think that kind of goes without saying. I don't need to say too much about that. Able to process and deal with emotionally complex situations. So, you know, this is kind of going to show that higher level of thinking, that empathetic thinking. You not only are you working through a problem, but you're considering all facets of the problem. So you're not just deciding, you know, who gets the lung. You know, if you've got that either or situation and they say, you know, who gets it, you're not just deciding that. You're talking through your reasoning and saying, well, if I had to decide on emotion, I would say this because, you know, this is what I would be thinking XYZ. But, you know, if I was thinking logically, I would decide this because of XYZ. So you're kind of showing them both sides of that story. So again, it's hard because they're looking for these qualities, but you have to make these qualities fit you too. You know, if you're not a team player, maybe don't focus on all the times you weren't a team player, because that's not going to go over really well. But try to drum up examples, especially of times where you've actually experienced these things. So what I would be doing in the prep is thinking, okay, when was I a leader, or when was I part of a team where I had to effectively communicate and I had to really challenge myself? And I would have 5 examples of being a team player and a good communicator, because that's most likely going to get asked. And the good thing is if you don't have to recall them from 5 years ago, if you've already recalled it from 2 weeks ago, and you can say, oh yeah, I remember before I was thinking about that time that I worked in the social advocacy group and nothing was working right, so I had to step up and take a managerial role in the group. You know, that stuff's already back of mind, so you don't have to dig through the troves to try and get there. So I think the main thing with these is that you're trying to kind of think of ideas already about how you can portray yourself as this type of individual. And again, you need to be able to demonstrate these in all interview responses. So some may be better suited to others. And that's where tailoring your answer a bit and starting to practice and getting comfortable with what you're saying and how you're saying it will be really, really useful, because you'll sound more competent and more confident, and your answers will be better because you'll have said them before. Obviously, you need to avoid being too robotic and practicing them 1,000 times and just memorizing what you're going to say. But try and flesh things out and make sure you're including a lot of different examples in what you're saying. So I've talked a lot, so I'll go ahead and pass it back to you then, Elliot.
All right, wonderful. Thank you, Nick. Yeah, some excellent points. And one thing I just want to mention, based on what Nick said too, is that you know, in our Interview Ready courses, one of the things I find a lot of students really struggle with is actually connecting, you know, answering the questions to their personal experiences. And I think you all should really take away strongly from what Nick said in terms of, you know, not just saying I'm a great team player, I really like being a team player, etc. Actually bringing in your experiences, you know, showing them a little bit about yourself in answering these questions. So these are really wonderful points for you all to take away from this. So these are, some of the do's and do nots, I guess, of the medical school interview. These are certainly not prescriptive, but some things that we maybe recommend to think about doing or not doing on the day. So the first point here, I think, is really important for everyone, is to ensure you dress appropriately. And this might be something maybe Nick can talk about a little bit later with the, Flinders interview specifically. But we also have to remember that a lot of, the medical profession still are sometimes, quite conservative and expect usually quite a formal dress at interviews. This might be even something as basic as what we, call in medical school clinical wear, which is something, like a button-up shirt with slacks or business pants with, leather shoes, for example, for men. Or it might be, even like a lot of, it's very common to wear suits, and that was certainly really common at my interview as well. And I do swear, I interviewed on the Gold Coast, there was one person with board shorts and thongs on. I kid you not. So that was a do not, that particular dress. And I don't want to pretend to maybe give ladies advice on how to dress appropriately here, but I think maybe just talking amongst other female candidates as to what was appropriate and thinking about the conservatism of the medical profession will probably suit you quite well, I think. Introducing yourself professionally in interviews is, of course, really important in the panel interview, because you're stuck with the same interviewers for 40 minutes or so. And I think it's really appropriate to make sure you introduce yourself well. And I remember that I went up to each of my panelists and introduced myself with my full name, and went to and kind of felt the social vibe for a handshake or not, which might be now different in the COVID era. And very important, articulate yourself well is obviously vital. And I think a lot of the things that I have seen where students have some problems is that they try to spit everything out all at once. And sometimes you just need to, take a moment to pause, reflect, gather yourself, and then make sure you have a structured answer. It might be even something as simple as buying yourself time, like repeating the question back to the examiner to just confirm what they're asking, for example, or just saying what you understand at this present time, which might just give you a little bit of time to think about, an answer. And we will discuss some frameworks briefly as to how to approach some of these example questions that we have, which might help you think through, addressing these. So a poor candidate, this is some things that you should probably try to avoid. Excessive gesticulation, which is like, throwing your hands up everywhere, like if anyone knows the Swedish chef from the Muppets. If anyone remembers that, I don't know if it's Swedish or Norwegian. I think there's some controversy there, but he's very high gesticulation. Try to avoid that if you can. And just like I said before, just launching the scenario without thinking is probably one of the things that I consistently see is a big problem from students. And it's really hard for an examiner to follow your tangential train of thought unless you have a really structured, answer, which is easy to follow. Another recommendation is, if you're nervous, if you're shaking, going for the water and trying to drink it can sometimes be a bit of a water hazard where you might spill it on yourself or spill it on the examiner or all over the desk or something. So just be careful when you're going for the water if you're shaking a lot. And probably the most important thing I think is reflecting on something Nick said before, is make sure you don't memorize responses to questions. Just like you wouldn't memorize, a section 2 essay for the GAMSAT, you shouldn't memorize any responses to particular questions. And I think, just like Nick mentioned before, preparing yourself is vital for the interview, just like for any test. And you should be thinking about all the different types of questions you might be asked. And like for me, I wrote down answers to a lot of dozens of potential questions to practice. But I never tried to memorize these, but it was just the process of actually trying to get them down to paper, to articulate them well, to think about how I would frame my response. But memorizing them is a big no-no.
Yeah, and I completely agree with that. I think that the framework is more important than actually the response. So I think something that's very, very underrated, and I don't know, maybe I haven't talked to enough people that did med interviews, and I've just interviewed enough people that are just applying for jobs. But I know that in the real world, if you ask someone a question, 9 times out of 10, they just launch straight into an answer without having any idea where the answer is going to end up. It's completely acceptable to say, Yep, I'll just take a few seconds to think about that, please, or something along those lines. That's probably not the best articulated. I think I was a lot more articulate when I said it in the interview, but there's nothing wrong with just taking a few seconds to yourself and thinking, okay, I've got this experience. I've got this experience. How can I tie that in? Okay, perfect. Especially if it's an ethical thing, if it's, a compassionate thing, it shows that you're actually thinking rather than just trying to say what they want or memorizing a response and moving through it. So I think that that's very important. And as far as the dressing, I think Elliot nailed it. You can't overdress unless I don't know why you would be overdressing. Maybe if
Top
you wear
hat
like
or
a car
something.
coach in the interview. But I think dress very, very smart. I think most people, as far as guys, had suit jackets, ties, suit shirts, slacks, all the nice things. Make sure your shoes look good. Don't go in with scuffed up shoes, all that kind of stuff, because people will see those things. And as unfortunate as it is, that's the first thing people see. And that kind of sets the tone for what the interview will be like. So even simple stuff like shave before you go, get a good haircut, it does tie in as well to the look good, feel good stuff. So that stuff is really important. So if you're unsure, go out, get yourself a suit, get yourself a nice dress. It will be worth it. So I guess just to briefly go through some of these, because we'll kind of pull them apart a bit more as we go through. And I think it's probably more useful to talk through them rather than just saying what they are. But some of the question types you'll see, so classic ethical scenarios. This is about problem solving. It's typically about really quite difficult scenarios that maybe don't have a right or a wrong answer. And there's just trying to see what your critical thinking is like. So whether or not you can talk through a problem, analyze both sides, and then kind of come up with a solution that might be a happy medium for everyone involved. So, it's typically hard stuff. You never know what you're going to get. I think in our practice, when we had a group together in Adelaide to practice before the interviews. I think there was a lot of questions about HIV and blood donor forms and being able to, having to mark on a blood donor form if you're HIV positive and whether that should be a requirement and things like that. And it doesn't necessarily have a right or wrong answer. And the important thing is to not just come up with an answer, but to talk them through your thinking. You're kind of thinking into open air here and saying, well, in this case, I'm thinking about the person that's going to receive the blood. You don't want that to have a flow-on effect to the rest of the population. But I'm also thinking about the person who's donating blood because that infers a lot of things about them personally, and it may be a very personal thing to share. And so you're kind of talking through both sides of the argument. And then maybe at the end, you do come to a head and make a decision. But I think the other thing too with ethical scenarios is you don't always have to have a decision because they're not meant to have a right or wrong answer at the end of the day. They are tough. They're real tough. There's no getting around that. The motivation to study medicine. I mean, this is classic. Again, the main thing you don't want to do is just say, oh, well, I want to get paid a lot and I think it'd be pretty cool. We'll talk a bit more about that though. Science knowledge, so detecting things, talking in layman's terms. Obviously, they're probably not going to ask you some really complicated science thing that you have to know about. So they might not ask you about the most recent treatment method for COVID-19, but just generally some science things and just whether or not you can relay that in layman's terms. And health knowledge, so not necessarily about, again, treatment methods, but about political things or about social issues or anything like that. So it kind of shows that you're aware of the climate in Australia and maybe around the world as well. And maybe in one of these instances too, while it may be very tempting to talk about COVID, that's probably what everyone's going to be talking about. So you might want to kind of brush up on a few other health issues that's not just that. And I think just looking through the rest of these, again, going quite quick, behavioral questions, it's how you are as a person. They kind of talk about your moral compass. Again, kind of like what I said with the ethical scenario, it's very, very similar. It's probably a good outline. So the STAR, situation, task, action, response. It's kind of just a broad format of, you're explaining the situation to them, telling them what you're kind of considering. You're telling them what you have to do or what the task at hand is, what your actions are going to be, and what the response will be to that. It's kind of just setting yourself up to not fail by having a structure beforehand that you can kind of follow. So it's like setting yourself a SMART goal. You're more likely to achieve your goal if you kind of lay out each individual facet of the goal that you need to achieve. Practical tasks and puzzles, is a lot of variety in these. Is not probably a way that we can tease these out really well. Again, commonly with team stuff, collaborative building, leadership, those type of things. In group work. So again, we won't touch too much on it because Flinders doesn't have much group activities, but you divide into groups, given a problem to solve. Again, it's about how you interact with other people, your problem solving skills, whether or not you can come to a consensus, if you can work as a group, if you can effectively communicate. So yeah, I think you're not likely to see all of these questions necessarily, but you're likely to see a lot of these questions in some way, shape, or form. So I think practice is the main thing, and being comfortable kind of teasing out these really uncomfortable topics is really important, because you don't want to find an uncomfortable topic on the day for the very first time, because that will throw you off, and that's the last thing you want when you're sitting in an interview that will decide whether or not you get into medicine.
So this is, we'll now go through a few different examples of what these stations may look like that Nick has laid out so well. So I'll just kind of talk you through, I'm not going to like say the answer for this, or arguably there might not even be a correct answer, but kind of just talk you through some of the thinking and issues that you should probably consider when approaching the ethical scenario. So our scenario here is that a friend has told you that she is pregnant and that she hasn't told anyone else and will possibly seek a termination. One day in class, she becomes unwell and your tutor asks you if she is pregnant. How do you respond? So one of the first things I think with ethical scenarios that you should think about is firstly your role in this. So, are you you're obviously a friend in this particular scenario, and you need to be really cognizant of who you are in this scenario and what your duties and responsibilities to others might be. And related to this, the second point is that the relationships between different people in these ethical scenarios is also really important. So you're a friend with someone here who you know something in confidence about her health, and there's a tutor here who is obviously some kind of educator in your class who has a professional pedagogical relationship with yourself as well as your friend. So these are a few things that I think you firstly need to think about and consider, and I think probably even speak through as well. And then you need to start thinking about what kind of ethical issues are involved here. These are things that you might want to say if you can integrate them well into your answer too. It can sometimes demonstrate that you have thought about this kind of stuff before, and you have a good level of knowledge about ethical issues. And the common kind of set of ethical issues are beneficence, making sure you work to people's best interests, non-maleficence, making sure you don't do any harm, justice, and no justice. Do you know what the other one is, Nick? There's a fourth one.
Well, not off the top of my head.
I should know that. I'm a lawyer, but we're not very good with ethics. But anyway, the another one that's really important here is confidentiality, of course. So these are the kind of issues you have to think about, and I think it's really important to speak through with the examiners. This isn't just happening in your head and saying, well, what we know here is that I have a duty of confidentiality with my friend, which has she's imbued her trust with me to keep this confidential, obviously, because she hasn't told anyone else. So it's obviously very important and private to her, especially if she's told you as a friend. We now know that she's become unwell in class. And you have to also clarify that you're not sure how unwell she is, right? She could just have a mild headache. And if your tutor suddenly just asks if she's pregnant, you blurt out to everyone in the class, yeah, she is, when it might not be relevant at all to her health, perhaps. And the harm in blurting out this confidential information may be a lot greater than the good that it's done in sharing that health information. So these are things you have to consider, her confidentiality, ensuring that no harm comes to her, looking out for her best interests. These are the things you need to think about in this particular scenario. So now when the scenario has changed a little bit and a paramedic is attending the issue, so obviously you then would maybe say to the examiner, there's some assumptions here that maybe it is a little bit more serious than we knew before, and ask her if she is pregnant. And then I think if these kind of new bits of information, you just need to revise and say, well, these same issues, ethical issues spoken through before, there's now maybe some different aspects to it. There might be some kind of health issue that we need to worry about where this could be relevant to possibly disclose this if it's an emergency. And again, I think with a lot of these ethical scenarios, you just have to talk through your thinking identify the issues, the relationships, and come to some kind of conclusion, seek further information is also really relevant as well. So the girl's mother then calls you the day after the incident and asks if her daughter is pregnant. What do you answer? Again, this is something you just have to think through just in the ways that I've identified before. And maybe probably the most important thing here is to actually consider, beneficence and non-maleficence now, not only from the daughter, but also the mother as well, and the relationship between the mother and the daughter. Because if you tell the mother that she's pregnant, that could create a lot of conflict in that relationship. And even though maybe arguably it might be important in certain respects for the mother to possibly know about that, arguably this is something that is debatable depending on what relationship they have. It might be something that is certainly not your place to disclose anyway, and you could do a lot of harm to their relationship if you do so. So it might be something that you might talk to the daughter about and try to encourage her to discuss with her mother if she thinks it's important, and discuss about this with her after you kind of maybe deflect the question from the mother. Because I think really most of the time, and especially if the doctors haven't revealed this information to her, then it probably definitely isn't your place to do so. Now the girl has decided upon a termination. How do you respond to her? So this is kind of finding out, how empathetic you are. And I think it's really important to identify the issues again through here in terms of, how much emotional stress should be under, how much pain and strife to go through such a decision like this. And your role here, again, as a friend, you're not a medical doctor here who's going to perform it or anything like that. You're just a friend, so you just had to advise her, make sure she's thought about all the consequences, all the options she has, and just ensure that she has the support that she needs, most importantly. So these are kind of, these questions are huge, and there's obviously a huge amount you need to talk through here, but these are just some of the things that I think you really need to consider when dealing with the ethical scenario.
Yeah, and I don't think that those scenarios are easy at all, so do your best. So the next thing is motivation to study medicine. So classically, this comes out in one way or another, because that's what you're going to be doing, and they want to know why you want to do it. So this question is probably a really good example of how they can kind of word it in different ways that feel tricky, but in essence, they're trying to find out the same information. So what do you intend to do if you do not get accepted into medicine this year? They want to find out, are you just going to give up? Are you going to sit the GAMSAT again? Are you going to do what? Are you going to work? Are you going to try and get internship experience? Are you going to get a job? What's your job going to be in? Are you going to volunteer? Are you going to, it's kind of the idea of, worst case scenario, obviously. And I think everyone should have a backup plan, which is really, really nice. But it's kind of finding out that, if you don't get it, what are you going to do to make sure you get it next time? What are you going to do to get yourself closer to getting there? And I think the big thing is that broadly, because I think a lot of times you'll get the question of why you want to study medicine. It may not be as clear cut, but most people, will say, oh, I want to help people, or, oh, I want to do X, Y, Z with my life. That the problem is that when most people say that, it doesn't come across as special. So I think the important thing, first of all, is to find out why you do want to study medicine and relate it to your personal experiences. I think that's probably the most powerful thing, because enough people can say, oh, well, I see doctors on TV and my parents work in a hospital and I think it's really, really cool. And, from the outside, I see this really cool experience that they talk about all the time. And it kind of doesn't give you anything of substance to add to that question. So you need to put yourself in a position to be able to say, I experienced this. It's led me to investigate this, and now I want to do this. You don't have to say, oh, well, I want to specialize in this because I want to fix teeth in Africa or something along those lines. But, giving a piece of substance that, makes them remember you rather than just remembering, oh, well, yeah, that person obviously wants to study medicine, but so does everyone else. And I have heard before, I think when I was prepping, I had a few people say, don't say because my parents do it. And neither of my parents are doctors. So that doesn't apply perfectly well for me. But I don't know that I completely agree with that, but you have to have a reason why you're saying what you're saying. So it's not good enough to just say, oh, my parents do it, so I want to do it too. What have you experienced through that has led you to think that it'll be good for you? How have you experienced the medical field in any way, whether or not it's your own personal experience, whether or not you've volunteered, any of that type of stuff that's led you to think? Because the other thing you have to think of as well is if you go in there and you say, oh, I want to help people. I worked in the hospital as an intern when I was 18 and I thought it was really cool. What they're going to come back to you and say is, why don't you do physiotherapy? Why aren't you doing nursing? Why aren't you doing phlebotomy? All those things have to do with healthcare. They're all in the hospital. They all get you to that same goal. And then again, you have to weigh up the idea of, well, you don't want to just say, oh, well, because doctors make more money. That's why I want to be a doctor, obviously. You have to have a reason why you are going for that extra step. Why are you going to put yourself through 4 more years of quite intense school and then do an internship year and do you want the continuous learning? What are you looking to get out of it? And because it's something that's very, very commonly asked in one way or another, it's really important to feel really strongly about it. And if you don't feel really strongly about why you want to study medicine, maybe do a bit of soul searching and I guess find that out for yourself. But Elliot, do you have anything to add with that? You're probably a bit better given that you do the interview ready prep.
No, I think your points are really good. And this question comes in lots of different forms. Sometimes it's just like, why do you want to be a doctor? And I think you're absolutely right. They're just looking for a kernel of like a real purpose behind your reasoning, not just, my parents are doctors, but there's actually a story behind it that's personal and speaks to you. So I agree with you, Nick. I don't really have anything constructive to add. So this is a deep tech question, and these are actually what we call like a Melbourne University special. They're kind of I don't know if they were birthed at Melbourne Uni, but there's something they focus on quite a lot every year. They're kind of classically known for these types of questions. Although apparently there have been a couple of times in the last few years where they haven't asked these particular questions, so you can never really know. But you can see that these questions aren't usually particularly complicated. They're not asking you to explain like treatment for COVID, for example, as Nick gave before, but just something, in simple terms like what a cell is. And I think the trick with this question is that when you're really stressed and uncertain at the time, you're going to revert back to the jargon that if you're a natural sciences student, for example, and you're going to be talking about organelles and mitochondria and all this kind of stuff that that no one else really knows what the hell you're talking about. So it's really important to do your best to relate it to something that a normal a normal person will understand, right? So it's saying that a cell is like maybe like a building block of a home, and you have to have lots of them to make up a house which has different functions and so forth. So using metaphors can be really helpful, related to someone's lived experience. And a lot of students I've found in our interview courses become very frustrated when the examiners don't understand what they're saying. And for instance, often our examiners for this are also lawyers. And and often the candidates will get really frustrated. And I've had some of them call some of our lawyer examiners say like, oh, what, are you stupid? How can you not understand this? So don't do that, of course. So try to relate it to someone's lived experience, remain calm, and just stop and think before you say anything.
Yeah, great call. And I reckon we might try and move a bit quicker to these last few, just because hopefully by now you guys are getting a bit of a gist of what we're talking about. But health knowledge, I think it comes up quite often. They're just trying to see if you've got a bit of an idea about what's happening socially. Like I said, there's a lot of push for like rural and Aboriginal and Torres Strait Islander people's health. And I think that, they want you to know, they want to see that you're kind of connecting with it in some level. So do a bit of reading, find out what happens, and try and relate it to an experience. I think with this, it's not, in my opinion, obviously, all this stuff is in our opinion, but it's not really good enough to just say, oh, the statistics say this, and X number is this, and 20% is this. If you're just railing off facts, they know the facts. They don't need to know more facts. Knowing that you know the facts is good, but why is it important? Why do you care? Why does Australia care? Why does why does it matter? Trying to say, oh well, I went to a rural community and I did 3-month school trip to Darwin and I worked with XYZ and I saw that there's this big discrepancy in the care that's given, and obviously part of that's because of the rurality of it all, but part of that's because of resources, and then you're fleshing out an experience you had. Again, you're adding something personal to it, and you're giving a good answer. So hopefully that kind of makes sense, rather than just saying, this is the problem, this is what Australia faces, these are the legislations that are coming in to try and fix it.
So this one, just like as Nick has said and spoken a lot on this before, so I won't spend too much time on it. When was the last time you displayed leadership is a really common question, or for example, something like when was the last time you experienced failure? These questions are incredibly common in most interviews, and it's again making you think about a real experience you had and how it relates to the question and how it actually tells the examiner about yourself as a person and your lived experience. So I get a lot of students who answer like, I had a group assignment and I helped, and I wrote the thing for everyone else and got it done. So everyone and their dog will be talking about, academic group assignments that they did in university. Try to think really deeply about leadership. And leadership is not just that you climb Mount Everest, but it's actually, it happens every day in the workplace, happens, at home, everywhere there's, opportunities for you to display leadership. So you need to think deeply about this and actually use your lived experiences to answer this question.
So the practical task / puzzle, I think this is a bit of a strange one that probably isn't done often if you're just by yourself, but they may ask you to do it to the presenters, and kind of similar to the fact that you're kind of explaining it from scratch as explicitly as possible. So this is just one example. Person one's given an origami shape structure. They must then describe it to person two. Person two has to try and recreate it based on the instructions. And person two can ask questions, but cannot see the original structure at all. So, I think this kind of, I don't know if anyone's seen it, but there's a video on YouTube or Facebook or something going around of a dad that has his kids write out the instructions of how to make a peanut butter and jelly sandwich. And it just shows the things that are missing in context when you already know how to do something. So it's something like put the knife in the peanut butter and spread it on the bread. And the dad puts the knife in the peanut butter and spreads the whole jar on the bread, and no peanut butter actually ends up happening. The kid's like, oh, what are you doing? You're ruining my life. But at the end of the day, it shows those context clues that are missing. And it kind of shows that in order to be a good communicator, you have to be very, very explicit with what you're saying. You have to be detailed, but you also have to be direct because you don't have 4 hours. So it just kind of gets you thinking about that process and what they may ask. And again, these are just a few examples. They could have you do absolutely anything on the day. So be prepared for the absolute worst or be prepared for the absolute best.
Again, this is something that we're going to really speak about very much here because it's something that's associated with ANU. But this group work questions are very much just about you demonstrating that you're not going to hog the floor from everyone. You're not going to ostracize people. You're going to actually work as a team and ensure that everyone can contribute in some way or form. And I don't think we need to say much more about that tonight.
Yeah, perfect. So obviously things may be changing. As far as I know, I'm not sure that Flinders has said that they'll be doing anything online. I believe that theirs are in person as of yet, but I don't think that they've announced anything. So be ready for anything. Give it a test run for things that are online. So make sure you have the perfect lighting, the perfect spot. Again, if you have things in the background, I've done the same thing. I've got things in my room that way, and I've got things this way, and I've chosen this wall to try and make sure that I've got nothing distracting behind me. My lighting's probably not the best, but you get the gist. You don't necessarily have to go out and buy $1,000, what is it, the circle lens light or whatever they're called. But make sure you have enough so that they can see your features, they can see your emotions, and they can see you. Make sure you have all your equipment, computer, webcam, whatever you need. Eliminate distractions, the constant thing. Luckily, she hasn't done anything tonight, but I've got a 8-month-old puppy, and she very commonly likes to bark at the worst of times. So it's happened to me a few times doing like patient histories for exams that I've had. And you just want to get rid of that if possible, because it's added stress that you don't need. So get your family members to take them for a walk. It's only an hour long. It's not too bad. If you need to get your family members to take your other family members for a walk because, they're going to be loud, that's fine too. Just try to make sure you get rid of all distractions, get rid of any other browsers, close all programs, put your computer on do not disturb, whatever you have to do. Sit up, positive posture. You'd be amazed what the difference it can make if you're sitting, kind of slouched, or if you're properly sitting up, if you're centered on the camera. Try not to be leaning either way. It's just common things that you do in person, but maybe in front of a camera, you're not as comfortable doing it. And the last thing that I think is kind of important, which is a bit hard because I think everyone has the constant desire to look at themselves in the camera rather than looking at the camera, but making eye contact online, you're looking at the camera. You're not looking at yourself or the interviewers. So keep that in mind. Obviously, doing a bit of play back and forth and looking at the interviewers as well is important to gauge their reactions. But keep in mind that eye contact is actually at the camera, not at the screen in any place.
So just very briefly, these are some of the areas that they look for in scoring for the interview. And I also didn't mention, but I was privy in helping out as an invigilator at some of the Griffith University interviews as well. And this is generally reflective of the things they look for. And it's very much matched to the type of medical school candidate that they want as well. They're looking at the appropriateness of your response. You actually have that you are saying something that makes sense based on the question that they're asking, and that actually reveals a personal side to you, reveals a story about yourself. The structure is incredibly important, making sure that it follows something clearly, some kind of clear thread that they can hang on to and understand, and that you also adapt when the interviewer might interrupt you or something might change. For example, empathy, I think, is exceptionally important, one of the most important parts of the interview. Ensuring that you actually understand and respond to people's emotional states is exceptionally important as a candidate, but also as a medical student and as a doctor. Presentation and manner as well, something we've spoken about quite frequently as vital here too.
All right, and we're getting to the end, guys, so thank you for sticking with us. And just after this one, I've got a bit of Flinders specific details. So as far as preparation goes, you hopefully have all heard now that you've either got an interview or not. I think there might be some people that are still waiting, but I'm not entirely sure. Research types of questions commonly used at universities. We've gone through a few tonight, but there's lists on lists on lists out there. So talking to previous students, obviously not putting them in a bad spot given their non-disclosure agreement that they have. GradReady, they've got a lot of resources, and Paging Doctor, I don't know how many people have looked at that yet, but it's a really good resource. It can be a bit toxic at times because it's a lot of students that are really, really stressed, and there's no real filter for what's being said, whether it's true or not. So go in with a bit of a wary eye, I guess. But I think for the most part, they're all med students, so they're all people that are applying to get into medicine. They're all in the same spot as you. And it's just a really good place to bounce ideas off of people. Some, I think, posts even have a generated list of a couple hundred questions that have been asked in the past. So it's just a really good place to start getting your thought process going. Practicing your responses is really important. Again, don't memorize them, but just get comfortable with what you're saying. Start to see with yourself. I know I'm the worst for it. I like to gesticulate. So start to see that with yourself. If you do it a lot, think, okay, I'm just going to put my hands in my lap, or I'm just going to settle down a little bit and let myself, articulate and gesticulate a little bit, but not too much. And yeah, you can read the slide here. Listen to yourself back. As painful as it is, it's a really good kind of feedback mechanism. And your friends and peers will be the best. They pick people that are going to be hard on you. If you know that your mother absolutely loves every word that comes out of your mouth, I probably wouldn't ask her to help you with your interview prep, unless you need a bit of a pump up because you've had people that maybe have been pretty harsh with your critiquing. So get people that are going to be honest, get people that are going to be brutal, because the last thing you want is for people to just be nice to you and then you end up having a really terrible interview because the whole time they're saying, yeah, that's great. Yeah, keep going. Amir, do what fits you. If you can record yourself, great. Mirrors, whatever you think works. Again, don't memorize them. Do a dress rehearsal, so do a dry run the night before or a couple weeks before or a week before, just to get yourself in that groove. Know your outfit, know if you need to iron your shirt, know if your tie matches your pants or whatever else you have to do. For the ladies, make sure your dress is, the right length or whatever it may be. I'm not really privy on the things that change as far as that goes, but getting to the interview location the day before, again, depending on where it is, I don't envision many schools will have a requisite for being in person. But if you are planning to do it in person, make sure you are in the city the day before, because who knows what will happen with travel. And even find the place. So when I did my interview at Flinders, I think the Wednesday before I had it, I don't remember what the timeline was, if I had it on like a Friday and I went on the Wednesday, but I just went to campus on the Wednesday. I found the car parks. I found a 2-hour park that I could just pay for, and there's lots of spots. I knew that they wouldn't be taken up. I knew exactly what my walk was going to be down the steps to get to the theater that I was going to be in. I know some places, so last time they had them in the health sciences lecture theater complex. I don't know if that will be the case this time. It's probably the most obvious place to have it if they have them on campus. But again, just being comfortable with that so that you're not getting there on the day and going, oh, I think I'll have enough time. Surely I'll have enough time. You don't want to have any doubts about anything on the day. And again, plan to say when you don't know what to say. If you don't know what to say, have something in your back pocket that you can kind of resort on, or that you can be comfortable to say, look, this is this is a topic that I'm not really that confident on, or, something at least to make yourself sound well-rounded. So you're not just saying, I don't know, or you're not just sitting there for 2 minutes completely silent, because that's not great. I know we said before that silence is okay, and definitely embrace silence. I think one thing that we maybe haven't said is I think it's always powerful when you finish your answer and you decide that you're done and you don't continue trying to bring things up and you don't upwardly inflect at the end and go. And I think that that's a really important topic. It's not a great way. When you think you're done, finish it, and then you're done. Let the interviewers ask the next question. But yeah, just being confident with the whole process and making sure you know what you're doing on the day, how you're going to look, where you're going to go is all really important. Do you have anything to add to that at all, Elliot?
No, I think that's great. And I've always found silence works really well too, and would echo that 100%, Nick.
Cool. So I guess a bit more about Flinders, I guess my kind of suggestions when you're approaching the interview. So for any of you that are interviewing at Flinders, and I think some of these are more general too. The next slide has a bit more about Flinders specifically, but have an idea about the course and some of the requirements. So most of the universities that I've seen when I went to Deakin for my interview, and at Flinders as well, they require you to do some form of rural placement throughout your med degree. So it probably means that they heavily value rural experience or interest. So if you don't have any of those things, you don't have any interest or experience being in a rural community, try not to go in saying, yeah, I really don't like rural at all. I think it's just a waste of time, because that's not going to help you. So research what the important things are. Maybe there's new things happening at Flinders. There's exciting, they put a lot of time and money into research. Maybe they have specific research that they try to do. Maybe they're trying to build a new campus, or they're trying to add on to the campus for XYZ. Those are the things that it shows you've put time in, you've researched where you're going to go, and you actually want to be there. You're not just applying for a med school just to get in anywhere, even if that's the case. Some universities as well have bonuses for previous work experience or healthcare experience. So if you have that, talk about it in the interview. So that's another talking point to be able to say, look, I've got this background. This is why you should want me. And obviously understand the different streams. So even if you don't have, if you're not part of a specific stream or a sub quota, so I don't know how many people have heard about Flinders sub quotas, but there's quite a few different ones. Just understand briefly what they mean. So there's a rural sub quota, there's multiple campuses. So they have a Northern Territory campus as well as a South Australia campus. You don't have to understand the nuts and bolts of it, but just knowing that fact when they say, oh, well, how would you feel we give up students an opportunity to study in the Northern Territory in their third year? Is that something you'd be interested in? Rather than saying, what is studying in the Northern Territory, or what is the Northern Territory? You have backing to say, okay, look, I don't know much about the program, but I could assume that it would be more based around a rural opportunity. I'm interested in studying rurally because of XYZ. And I think the biggest thing, if you haven't done it, and you are interviewing at Flinders, is read the application guide, because that will tell you exactly what they're looking for, exactly how they're going to look for it, and the sub quotas, all that stuff. So Flinders has a domestic, international, PRCC, so parallel rural community curriculum, Northern Territory campus, various sub quotas. Just having a bit of an idea. I think it's like a 20 to 30 page document. It won't take long to read it. And a lot of that are kind of graphs and big kind of pictures. So you're not reading 30 pages. So it's worth, if this is something you really want, just have a look over it. Obviously, research what the interview style is, but we've talked a lot about that already. I think the one thing that I can kind of iterate for Flinders is they typically try to have someone from different backgrounds. So not just medical staff, not just clinical medical staff, but they have a potentially community member as well. So try to make sure that you don't just gauge everything directly at Flinders and Flinders medicine. You have to be, an interesting person for all parties involved. And the one thing that they iterated in the application guide is submit any supporting evidence as early as possible if you haven't already. That's just a general thing. That's not necessarily for the interview, but just a reminder, I guess. And so to be specific for Flinders, so they've said that the SA Northern Territory are going to be held from 21st of September to 2nd October, obviously subject to change, so we don't really know. And in their application guide, they say the qualities assessed are quality of motivation, learning style and team skills, communication skills, pro-social attitude, personal management and self-evaluation skills, and approach to decision making. So this is not something I'm making up. This is literally in their application guide for this year. For those of you, if you are applying to the PRCC stream, and if you don't know what that is, you're probably not applying for it, so don't worry. They have separate qualities that they assess just because that's their rural stream. So they're looking for a bit of different qualities out of that side of things, but it's not that different. So look that up if you are a part of that. But interviews are conducted by a small panel. We've said that already, commonly around 2 to 3 interviewers, and includes individuals from various backgrounds and professions, not just medical. So be ready for that, gauge your answers for everything, and obviously be willing to be flexible and change. But I think the biggest thing is they literally are telling you what they're looking for in a medical student. So try to make your answers fit that. And just general tips from me, and I think then Elliot can kind of add whatever else he has to finish off. But the biggest thing is the interviewers aren't provided with any background information about the applicant at all. So I think they're given your name, and I think that's about it. So the biggest thing is any experience you think is relevant, get it out there and talk about it, because they have no idea who you are. They don't know what your GPA is. And obviously GPA is a bit of one of those things that you probably shouldn't just say, oh, by the way, I had a GPA of X. But talk about your experiences, talk about your undergraduate degree, talk about your previous jobs, talk about your study experience. If you've done, a fellowship or a mentorship or anything like that, talk about everything, because even though you do a little bit of a blurb maybe for your application, they don't see that. They have no idea who you are. So talk about everything. The interview is going to be about 45 to 50 minutes. They say obviously it can go longer or shorter depending on how you go, but try to utilize as much of that time as possible. Yeah. If you're utilizing less of it, you're cutting yourself out time that you could be, again, talking about relevant things and getting them out there. And I think the other thing is that a lot of times, and I don't know if it will be the case, but you may get to the moment where they say, is there anything else you'd like to add to strengthen your application? That's one of those things that if there's something that you're thinking in the back of your head that you really wanted to say that you haven't had a chance to say it. There's no restrictions around what that final statement is. Obviously, you want it to be punchy and powerful. So maybe kind of practice what your closing statement's going to be. But, if they're asking you, say, look, I did some volunteering that I wasn't able to talk about. And this was the experience I had. And this is what I did. And this is why it's led me to this conclusion. And, I think this is a really important thing with Australia right now. And I think, for myself, this is another experience that I really thought. And then finish it by saying, and I just want you to know that this is something that I really want, and I really look forward to hearing from you. And thank you so much for your time and taking the time to interview me. Obviously that wasn't very eloquent because I haven't practiced for a while, but something like that makes you sound smart, just to be able to kind of put a timestamp and a final stamp on the interview itself. Obviously understand that they're conducted under exam conditions, so be smart. Socially distance, it's a big thing. At Flinders right now that's being a bit iffy is the fact that people aren't very good at socially distancing, and people in the medical field, I think, feel like they are immune to that sort of thing, so they don't have to do it. So just make sure you're doing all the right things. Yeah, socially distance, 1.5 meters from all people, act professionally. People are always going to be listening, even the people that check you in before you walk into the building. Be nice to them, be professional. Don't be on your phone. Don't be just hanging out, because who knows who's judging you for what you're doing? Who knows who has a say in the application process? Who knows what's actually an interview station? So just be aware for anything. And then, use those resources to your advantage. Like we said, the paging doctor is a really good one. Talk to your friends, talk to people who have been through the process before. Obviously, there will be a certain amount of information that they can give you, but even just talking through it with more and more people will help. So, Elliot, do you have anything else to add to that?
Just super briefly, I just want to echo, Nick, your point about knowing information about the university. I think is really vital. I had a question about, why do you want to study at this particular university, which I was really well prepared for. And I integrated I integrated the name of the dean into one of my answers. I was interested in, his research, and I was able to talk about some of the research outputs of the university and, places they're expanding and building to. and the overall aims of their program I tried to integrate as well. So I think these are really, really important to get across as much as you can. Maybe Nick, would you like me I can talk about these last few slides.
Yeah, that would be great. I think my voice is about to go.
Yeah. So firstly, we'd really love to have some feedback from you. And if Nick could maybe kindly put this in the Zoom chat, and I can transfer it to the Facebook page if it's not too much trouble, sorry. And, we have run a lot of these sessions, and we really, really love to hear feedback from you of them, how useful you found them. This is really helpful for us to, build and expand our seminars for next time. And I'll send this through in the main Facebook chat as well, so that on the event, so that you can give us some of your feedback. And one of the things as well that I want to emphasize for your, a further opportunity for you as well is our Millennials Scholarship, which is a scholarship which is available on our GradReady page, which you can access and go to and have a look at any time and apply for absolutely for free. There's no costs involved in doing this, and you have a chance to go, to win attendance comprehensive course, which is worth a bit of money, as well as $500 cash. So the application is closed for this on Sunday, 25th October. It's something you might as well just put your hat into the ring for. And lastly, maybe the point that I just want to quickly make here, which is demonstrating the improvements of GAMSAT scores for students who have gone through our programs. I just want to maybe emphasize that all the tutors in GradReady, such as myself and Nick, are really passionate about improving your your outcome in terms of your application for medical school, but also holistically trying to ensure that you're the best medical students and then doctors that you can be. We take our jobs really seriously, and we know it's really important what we do, and we really want to help you in all the ways that we can. We're very passionate about doing so. So I guess want to now just thank everyone for joining in. We haven't had any questions on the chat, but I really appreciate everyone being involved and coming along, and I just want to wish you a good evening.
Yep. And good luck with the interviews as they come around. It's stressful, but take it in stride. You guys will be fine.
All right. Thank you, everyone. Bye.